Hello and welcome to the Friday webinar. We are on with Dr. Stephanie Lamb. Welcome, Dr. Lamb.
Hi.
And we got Michiko in the background. Michiko's their Yule log. I'm sorry. I love your Yule log fireplace TV. It's the season. So today we're going to talk about iron storage disease. That's going to be an interesting topic. One I don't think we've covered, but what we haven't covered before. I'm going to make you a co-host before I forget, Dr. And
All right.
sorry, so you gotta tell us who's in your background, and I'm also glimpsing a fabulous sweater that I want right away. I want to know
Yeah.
to see
Well,
your
well,
sweater.
I'll hide the sweater for the moment. We've got Arroyo. He's over here in the corner. And then over here, we've got Maureen. So both of them are
Okay.
attending the webinar today. And then my sweater has two African grays on it.
Oh,
Uh,
that's so
so
cute.
it's super cute. A client actually bought it for me. I have a few very nice clients who sometimes get me gifts. And this one in particular, she always finds the cutest little things. And
Oh my
Uh,
gosh.
she had told me one time she really likes buying bird stuff. You know, she buys bird stuff for herself and she wants to get bird stuff for other people. So she knew that I would be an okay person to give bird stuff to because, not everybody likes birds. I mean, we all do, of
Well,
course,
I
but
know I've seen you at a conference before, and I know you like bird stuff because you came out there with all the bird stuff in your bags. You were like, yeah, I
yeah,
know. Oh, that's adorable. Okay. That's an adorable sweater. It makes you want to get a bird themed sweater for the holidays. Okay. If you're just joining us, let us know where you're coming from. Ooh, we got someone from Copenhagen, Denmark. Wow. Okay. Amazing. And let us know what the weather is like. And if we have time for questions, we'll do them at the end. And Dr. Lamb, I'm gonna let you take it away. I made you a co-host. So
all
I'm
right.
gonna just assume you have a fabulous um,
Yep.
PowerPoint for
I've
us.
got a PowerPoint for us. All right, let me
Okay.
go ahead and share. We'll get started.
Wow, we got a lot of international participants. This is amazing.
Oh, that's great.
Yeah.
All right. Well, so today we're going to talk about iron storage disease. And you're right, it isn't a topic that we've covered in the past. I may have mentioned it here or there in some of the other webinars as like we had our liver disease webinar probably a couple of years ago at this point. And I think I mentioned it as one of the things that can cause liver disease. So I've noted it here and there, but we haven't really done a deep dive into iron storage disease. So that's what we're going to do today. So first off, what is iron storage disease? Iron storage disease is goes by a couple different names. So you may hear it as iron storage disease. You may hear it as iron overload. Um, and then also hemochromatosis. Hemochromatosis is the more like scientific terminology that you will hear people sometimes use. But iron overload and iron storage disease also are appropriate. What it is where you get this accumulation of iron in the body and it causes damage to tissues. Now, iron is an element. I think we all, know of iron as that. And we usually think about iron deficiencies. People will talk about that, like, oh, I've got an iron deficiency. I need to take iron supplements to help get my iron levels up. And we probably deal with more iron deficiencies than we deal with iron overload problems. But, you know, iron is one of those things where you have to have it kind of just right. You don't want to have too little. You don't want to have too much. If you have too little, you go into iron deficiency. If you have too much, that's when you go into iron overload. And when you get this accumulation of all this iron in the body, it needs to go somewhere so it can, precipitate out in different organs. But in particular, it'll hang out in the liver. And if you just get too much of it, then it will start to cause damage to the cells in the liver. Now, it doesn't only affect that spot, it has the potential to affect other organs as well. It's just that liver is sort of the most common place that it may initially cause damage in. But it can also affect the heart, it can affect the pancreas. Sometimes it affects other organs, kidneys, it just depends. And sometimes it truly just stays in the liver. So it kind of can have a variety of ways that it will end up causing problems for a patient that has this condition. But when they get this damage to the liver, it can cause them to go into liver failure. because, you know, your liver is really important for lots of different functions. It is important for helping with like sort of your nutrient digestion, almost like your when you ingest foods and they get absorbed across the intestines, go into your bloodstream. They go to the liver first, where they get worked on in liver cells, broken down to the parts that they need to, the body needs to utilize, essentially. The liver is important for producing albumin, which is a really essential protein that's in your blood in circulation. It just has tons of really important effects. It, you know, gets toxins out of the blood, lots of different things that it does. And so if you have damage to liver cells, well, now you don't have enough liver cells to actually be doing the functioning of what the liver should be doing, and then your body can go into liver failure. When it affects other organs, like again, if it affects the heart, then you can actually start to have heart problems. And when it affects the pancreas, then you can actually see diabetes happen as well, because damage that can happen to the little pancreatic islets where insulin is being produced from. So while it's mostly something that affects the liver, other organs can be affected as well, and you can see a variety of signs from it. So who gets iron storage disease? Well, humans do. So you may hear somebody in your family, friends, someone you know, acquaintances who say, oh yeah, I have iron storage disease, or my grandmother has iron storage disease, or whatever. It is something that people do get. But other individuals in the animal kingdom, rhinos are a species that are really known for iron storage disease, bats also, and lemurs. These pictures that I have here are my own pictures from patients I've seen. I've never personally gotten to see a rhino as a patient, so I have no rhino photos for you guys. But I have a picture of a bat that I saw. This bat did not have iron storage disease. And then there's a picture of a lemur. And don't worry, the lemur is just sedated. Sometimes with animals, we do sedation for them just for safety purposes for the animals and for the people. And with the lemur, we were sedating him and he's just getting his weight there. So he just looks like he's sleeping, but he's fine. But these are the species that can get iron storage disease that are more well known in, you know, the literature to get this as a problem. But what about birds? Because we're here to talk about birds. So the species that we see it most commonly in birds are going to be, I should have put toucans first. I put here lories and lorikeets first, but toucans are actually the ones that we see iron storage disease in probably most commonly. Mynas also definitely are kind of top in that list, and starlings. Now, there's not a lot of people who have those guys as pets. I mean, I think they used to be more common. You know, mynas used to be fairly common as pets quite a while ago, but not so much anymore. But they do, you know, occasionally people will have a myna or a starling, and occasionally people will have a toucan as well. These guys can be sometimes a little harder to care for sometimes, so probably for the best that most people don't have a pet toucan. But it is something that we have to consider as a problem, because we really see it frequently in those species. Now, the birds that we're going to see it more frequently in, that are more common in the parrot world as pets, are going to be lories and lorikeets. And even them, they're not super common in the pet bird population as much as they used to be, you know. This picture here is a little rainbow lorikeet that was at one of those zoo exhibits that are more popular now, where you can go into a walk-in aviary and they have a bunch of typically rainbow lorikeets, and you can feed them because they just come fly down, and you hold your little nectar cups up to them and they can drink from the nectar cups. And that's just me holding a nectar cup out for one of those birds. But they are the species that we think about more commonly that could be affected by iron storage disease. Now, all those species, the lories and lorikeets, the toucans, the mynas, and the starlings, again, they're not super common. I wouldn't be surprised if the majority of the people on this webinar right now probably don't have one of those as a pet. Maybe there's a couple people on the webinar who do, or others who are going to watch this webinar later on that certainly are going to have these guys. But the vast majority of people don't. What we see more commonly, of course, is going to be things like African greys and macaws and Amazons and cockatoos and conures and all those guys. And so the question then is, well, do we have to worry about it in those guys that may be more common in the pet parrot population? And it's something that we don't see a lot, but it is absolutely out there in the pet parrot population. I have diagnosed it a few times. I haven't diagnosed it, hundreds of times for sure. I probably, at this point in my career, I have been a veterinarian now for 15 years. And I believe I probably have at this stage, maybe like from my own personal cases of parrots, I have diagnosed it in probably about 4 or 5 parrots. So 15 years in working with typical pet parrots, I only have about 4 or 5 cases. Now I have other cases that I've worked with that weren't pet parrots, and I do have toucans I've treated or worked with that were diagnosed with this condition, starlings that were diagnosed with this condition. So it pops up every once in a while. I do currently have one case that I am actively treating. But the cases that I've personally seen, I have personally, parrots, I've personally seen it in a lorikeet. I have had it in an African gray parrot. I've had it in a hybrid macaw. And then I've had a precursor to iron storage disease called hemochromatosis in a cockatoo before. Those are the ones I can automatically think off the top of my head. I think there might have been a couple others, but see a lot of patients, so sometimes I forget every single case. But those are the ones I can think of immediately off the top of my head. But there have been documentations of other species. There is documentation of a blue and gold macaw before having iron storage disease. And, in these individuals where it's not super common, I mean, I see African greys all the time. And I had one case that I've diagnosed iron storage disease in the hundreds of African greys that I've seen in my career. So it's not a super common problem, but it happened in that individual. And we needed to treat it. So we're going to talk about how things actually do get diagnosed, because if it's not a super rare disease, or if it's not a super common disease, it's a little bit more rare in our pet parrots. It's definitely one of those things that I feel like most veterinarians aren't thinking too much about. Even if you see birds every single day, we may not think about it too much because it's not that common. So it's something that we have to go through various tests to identify it and really show that, okay, this is actually what we're dealing with. So we're going to get into that. But first, before we get into all the nitty gritty stuff of the diagnosis and everything, one question that people often have is, well, how do animals actually get this problem? And the answer is multifactorial. We don't know in most cases exactly how it happens, but there are some things we do know. Now, in people, we know that there's genetic links to it. Because we see it more commonly in certain species like the rhinos, the lemurs, the bats, maybe there is some genetic link to it, or maybe even in the toucans, but harder for us to really say in non-human species, because just, we don't have as much data on the genetics of these guys. And so maybe in the future, we'll have more information in that to be able to say oh yeah, it's genetic in this species, but not genetic in this other species. What's really thought to be, at least for the toucans, the mynas, the starlings, what's really thought to be the reason for how they get it is that they may just have a more effective means of actually absorbing iron. Because in the wild where these guys are from, they may actually, and where they're foraging from and getting food from, they may actually be getting food from sources that may be iron poor. So not have a lot of iron in these food items that they would naturally be ingesting. And because of that, their intestines may be more efficient at actually absorbing iron. Because if you evolved in an environment where you don't have a lot of iron, and your body needs it because, again, like I said at the beginning, we probably see more iron deficiency problems than iron overload problems. You need iron in your body. It's really important in your red blood cells. Iron is a part of heme, which is like the substance, the molecule that binds oxygen and helps your red blood cells carry oxygen around the body. So, if you don't have a lot of it in your natural diet, you need to be really efficient at absorbing it. And so it may be that some of these species, like the Minas starlings and toucans, may just be better at absorbing it because they may be not getting as much of it naturally in their environment. So when they come into our captive environments, where we're giving them foods that are a little different from what they're getting in the wild and maybe getting more iron, then they may be absorbing all that iron really effectively, but then to their detriment potentially. So which kind of goes into the next thing of there could just be too much iron in the diet. But, even then, there are certain food items that we know are higher in iron. And so sometimes an animal may be being fed something that isn't really a part of their natural diet, and getting it more than they should, and thus being exposed to more iron and then being predisposed to the development of this condition. It's also possible that you may have too much iron in the water. Water isn't usually totally pure water, right? Usually there's other stuff in there too, other elements sometimes. Just depends on the water source. But sometimes there might be just iron in the water, and that's where it's coming from. It's possible that different inflammatory conditions may be a contributing factor to iron storage development. And sort of the reason that might be the case is if we've got these inflammatory conditions and you've got a lot of inflammation, you may be breaking down more tissues and things that may be releasing iron from places where it's stored, and then maybe it's getting into circulation more and then storing somewhere else. And so it may be that internal inflammatory conditions could be a contributing underlying cause. Blood transfusions could potentially be a cause. We don't worry about this so much, honestly, in veterinary medicine. I think this probably comes more from like the human side of things. When you investigate iron storage disease, they say that blood transfusions are a potential contributing factor. I think the reason we don't worry about it so much in our veterinary patients is more because, most of the time when we're doing blood transfusions, not that humans are getting blood transfusions for inappropriate reasons, but we don't do as much blood transfusions. Like, we have to have patients be pretty anemic before they're getting transfusions. They have to be showing signs that they're having problems from anemia, that sort of stuff. This picture here is just a picture of a eagle getting a blood transfusion, and this individual, I don't remember the exact reason why we were doing a transfusion on this individual, because this was several years ago that we had done that for this individual. But this individual was probably severely anemic, and symptomatic for having anemia, and thus required a transfusion. So possible, if you do maybe too many transfusions or something, you could potentially have that be a contributing factor, but again, not something we worry so much in the veterinary patients. Interestingly, things can actually increase the absorption of iron too. So vitamin C is something that can increase the absorption of iron from the gut. So it's possible that if there's too much vitamin C in the diet, then potentially it could be a contributing factor to increased absorption of iron, which could then contribute to iron storage disease. There's still debate about that. So you may hear different people saying different things about it. Some people say, don't worry about it. It's not that much of a contributing factor. And other people say, we want vitamin C to be very low in individuals who are susceptible to iron storage disease. So I guess the jury is still out on how much that is a problem. Now, what are the signs that we might see in a bird who has iron storage disease? Well, unfortunately, sometimes none. Sometimes we don't see any signs at all. And that's when it's difficult. Because if an animal looks perfectly normal, is acting normal, its physical exam checks out okay, why would you have any reason to expect iron storage disease? But there definitely are cases out there of iron storage disease that are just subclinical. They are not showing anything, at least to our eyes, that we can identify to say, oh yeah, I think that there's this disease process could be going on. So unfortunately, some of them, no signs whatsoever to give us a clue. But when they do have signs, some things we may see, weight loss. But as we've talked about in many other webinars, weight loss is something that is very non-specific. There's so many different things that could make an animal have weight loss, right? So weight loss, yes, it can be seen, but no, it's not. You should not be thinking about iron storage disease as the first thing when your pet has weight loss unexpectedly. Now, Maureen just said, okay, she's participating. Uh, so the next thing that you may see, and this is probably where I've had more people actually recognize signs of iron storage disease, is abdominal distension. So what causes abdominal distension? So first off, this is a picture of a little conure, and I'm trying to show the evidence of abdominal distension. So the little conure, his head's kind of up here, tucked between the handler's hands for the moment, so you can kind of see over the keel area, and then this is down over the abdominal region. And what you can kind of tell based on how the feathers are on this bird, like so you can see the feathers over the keel are a little bit more flat, but then when you get over the abdomen, you can kind of see they kind of like poof out a little bit. Now, this bird does have a little bit of feather destructive behavior, so that may play a little bit of tricks with your eyes, but you can sort of appreciate that this back part of the body, the abdomen here, is just a little bit more rounded than it should be. Most of our birds have a very concave abdomen. The abdomen, normally the skin's so tight over the bones between the keel and the hip bones, the pubic bones, that the skin gets pulled and almost has this like kind of tight sort of concave appearance. So when there's abdominal distension, it gets pushed out and you get this convex appearance. And if you look at the bird from the side here, here's the keel. We're following it down. The keel's kind of long. And then when we get to the abdomen, you can see how it's kind of rounded here. Normally, it should be, again, concave. This is convex being pushed out. It should be concave. So that's an example of abdominal distension. What causes abdominal distension? Two things. Ascites, which is fluid development, or organ enlargement. So if an organ is big, then it can make that abdomen be more distended appearing. Or if you have fluid buildup in the abdomen, it can make the abdomen be distended. Both of those things can happen with iron storage disease. In my experience, personally, I've seen more along the side of it being fluid, though, that is developing. They may present with signs of liver disease. So signs of liver disease, you can always, refer back to that webinar we did previously on liver disorders, but signs of liver disease, they may have like a rapidly growing beak that gets elongated really quickly. In that beak, they could have these like little linear striations at the very like tip of the beak. They may have what's called petechiations in the beak or on the nails or the feet, any of the non-feathered areas. What petechiations are little red spots. And basically they're little hemorrhages under the skin. The liver is really important, like I said, for many things, but one of the things is producing clotting factors. And if they don't have appropriate function of their liver, they may not produce these clotting factors. Their blood may not clot appropriately. And so if they bang themselves against something, like a normal simple bump against something that wouldn't be a problem, they may have a little bit of hemorrhaging underneath the skin or what have you, and have these little like red spots. And you can see it in the birds who have more of a like peach or yellowish colored beak. You may be able to see it. The black beaks, harder to tell. But you could potentially see petechiations in the feet. Again, if there's less pigment in the feet, if it's more along the lines of like being kind of pink, then you'll see those. When they're darker pigment, a little harder to tell. Sometimes you can see it in the toenails. You may also have a bird that has green colored urates, which is the white part of the dropping. That white part of the dropping should always be white. If it is green, there is a problem. And you can see liver disease causing those urates to be green. Signs of heart failure may be present. We did do a talk on heart disease as well, so you can also refer back to that webinar too. But just briefly, signs of heart disease may include things like being lethargic, having respiratory distress. Sometimes birds have weakness and they almost walk around like they're kind of wobbly, almost like they're drunk. That can happen with heart disease. And then sadly, sometimes just sudden death. They may just seemingly be okay and then suddenly pass away. Um, so that is unfortunately something that can happen with iron storage disease. So how do we diagnose it? Let's say we have this bird come into the hospital. We see some of these signs that we go, something could be going on. We usually want to do some workup to try to figure out what's going on. And usually we're going to be doing workup starting off with very basic things, blood work and radiographs. Blood work and radiographs are a great way to start most of our diagnostic workups because they're kind of casting a broad net to look for various underlying disorders that could be causing this bird to be having just signs of weight loss or being lethargic or what have you. On blood work, what we may actually see is high liver values. There's several liver values we look at. One of the most important ones is called bile acids. It's the most sensitive indicator of how the liver is functioning. And so sometimes that might be elevated with iron storage disease. It isn't always, but it potentially could be, and it could be our clue that something's going on with that liver if the bile acids is elevated. There's also AST, LDH, amongst other values that we can look at. X-rays are helpful as well. Those allow us to get a picture of the bird. So we can see kind of everything sort of in the coelomic cavity. We can see the bones, we can see the lungs, we can see the air sacs, heart, we can see the liver, the intestines, the gonads sometimes if they're active. I have a picture here, just 2 x-rays for comparison. Now, the one down here is going to be a bird that's a little bit more normal, just to sort of orient you guys to looking at x-rays. The bird is on its back. Its head's kind of up here out of the screen. Its tail is down here out of the screen as well. And then its wings are sort of held open and out to the sides. And then the legs are kind of pulled down here. So he's just like laying on his back, essentially. Everything that's black is gas. Everything that's really bright white is bone. And then sort of all the grays in between, the shades of gray in between the black and the white. Those are soft tissues, fluids, those sort of things. So when we take an x-ray, we're basically taking, a picture internally, and it's sort of a 2-dimensional image of a shadow of the organs that we're looking at. And so up here in the upper portion of the chest, this is the heart up here. And then you can kind of see how it gets narrow and then it kind of widens out again. This area where it widens out, this is the liver silhouette. So what we call this sort of junction, we call it the cardiohepatic silhouette. So cardiac hepatic silhouette. And normally people will say it has an hourglass sort of shape. And you can sort of see that in this normal image here where you kind of have like an hourglass sort of shape, the heart and then the liver. So heart balloons out at the top, liver balloons out at the bottom of this hourglass. When we have a patient who has an enlarged liver, you lose that hourglass shape. So if we go up to this picture up here, the one at the top, okay, here's our heart up here, but see how it balloons out and you don't really have that narrow waist of the hourglass. Instead, we have what's called a pear shape. And so this is what we call an enlarged cardiohepatic silhouette. And when we see an enlarged cardiohepatic silhouette, I can measure the heart and I can see if the heart's an appropriate size. And then I can take a measure, which is kind of what we're doing here, of just kind of seeing how wide that liver margin is. Now, that can happen with liver enlargement. You see the liver getting big on x-ray, but x-rays are taking shadow pictures, essentially, of the insides of an animal. And so other things can kind of superimpose against the liver and also like obscure that shadow image. So when I see this image, I can say, okay, I have an enlarged cardiohepatic silhouette. It could be because the liver is enlarged, but it could also be that there's some other organ behind it that's like pushing the liver up and making it wider than it should be, or maybe the GI tract's distended in some way and it's making it look bigger than it should be. So I have to keep in mind that there could be other things causing this sort of distension, but this was a case where it was confirmed that this liver was actually enlarged. So you can see the difference between these two birds here. You can see this narrow hourglass shape to this wide pear shape. That is a big liver on an x-ray in a bird here. Other things we might see on x-rays, we might get poor detail in the body because if there's fluid in the body, that fluid has the sort of gray appearance of the soft tissues. And so it kind of like blends around the soft tissues and you just get this like whiteout where you really can't see any definition to anything in the body cavity on the radiograph. So then sometimes what we'll do is we might do an ultrasound as the next thing after the x-ray. Because if we have this fluid that's built up and I can't see anything on the x-ray, I go, okay, there's something definitely abnormal on this x-ray. It could be fluid. It could be an enlarged organ. I need to do an ultrasound now to actually get better definition and identify if there's fluid in there or if there is some sort of organ enlargement. When I put an ultrasound probe on the bird, usually fluid is going to pop up pretty easily. I should be able to see fluid quite well with the ultrasound. But then because we know that iron storage disease can affect the liver and make the liver large, I might see the liver looking big. And I also want to look at the heart too, since we know that iron storage disease can affect the heart, and we may see some heart changes as well, potentially. Again, you don't always have heart changes, pancreatic disorders associated with iron storage disease. The liver is certainly the first part of the body where there's a problem, but other organs can be affected. So we've got our sort of broad net casted diagnostics done. We've done our blood work, we've done our imaging or x-rays, and now we go, okay, well, I know that there's something wrong with the liver because my liver enzymes are elevated on blood work. The liver looks big on my x-ray or ultrasound. Now, in order to figure out what's going on with that liver, to truly know, because even then it doesn't tell me that it's iron storage disease, it just tells me there's something going on with the liver. I know I need to do more advanced specific diagnostics directly at the liver. So really, the best thing is to actually take a biopsy of the liver. The reason you take a biopsy of the liver is because if you can get a small section of it, then you can send it off to a pathologist. They look at it underneath the microscope and they can tell you what they're seeing. Do they see things that look like iron storage disease, or do they see things that look like something else, like an infectious process, a cancerous process, some other type of toxin or what have you? So, but we do the liver biopsy, and these pictures here, this is just an African gray. This is actually the African gray that was diagnosed with iron storage disease. This was just prepping him for the surgery. He just has, you can see all these little ECG leads hooked up just so that we're monitoring him appropriately during the anesthetic event, because it does require anesthesia for us to do a liver biopsy. This is a little IV catheter in place as well that helps us to give him fluids during an anesthetic event so that he maintains his blood pressure really stable during the anesthesia. This is a picture of a toucan who was having an anesthetic event done, also trying to look for iron storage disease. But when you get your biopsy, this over here is a picture of liver, and it is a histopathology picture. So we took a segment of the liver out, sent it off to a pathologist, and then they look at it underneath a microscope. They do special stains on it, and they tell us what they're seeing. And this particular picture here, they put a special stain on it called Prussian blue. And so you see all these little blue spots in the image here, all those little blue spots all over the place, those are iron pigments, because this particular stain will like attach to iron really well, and it's going to light it all up. So all these little blue spots is all this iron that's built up in the liver. These pink things, these are liver, it's the nucleus of a hepatocyte, so a liver cell. So like we've got one little liver cell here with the nucleus on the inside, another little liver cell here with the nucleus on the inside, same thing. So a whole bunch of liver cells, one after the other, stacked up over here, and then you have all your iron that's accumulating in it. When we find this on histopathology, we then do a couple other things. We want to know the level of, like, is there other damage that's happening in the liver? Because you can't have iron accumulate in the liver and not have it cause damage yet. When it accumulates in the liver but doesn't cause damage yet, that's when it's called hemochromatosis. When it accumulates in the liver and it starts to cause liver cell damage, that's when it's called hemochromatosis. So very similar names, but just slight differences in what's actually happening at the cellular level. And so we want to know, is this hemosiderosis, where you just have a lot of iron building up, or is this hemochromatosis where you actually have destruction to cells and damage? And that's the pathologist is going to tell us that information. And obviously, if you're having damage and destruction, that's like the worse off place to be. So we can also then actually measure iron levels in the liver. The pathologists, when I've had it diagnosed before, they've said, hey, you've got iron storage disease. And then they will say, do you want us to send it out to find out the actual quantification of iron in the liver? And I usually do because I find that helpful. We can quantify actually how much iron is in there. And there are references that we can refer to. It's not completely complete references out there, but there are references for a few different species of birds to say like, okay, we know that cockatoos should have this amount of iron in the liver and be healthy. So we can compare to that to see like, okay, how much does this individual have? Now, interestingly, you can actually also diagnose iron storage disease by doing an MRI, which is really cool because it's less invasive, right? If I can do something less invasive, like that's what we want to do. We want to be as least invasive as we possibly can. But with doing an MRI, basically the patient goes, gets an MRI done, and then there's particular software that the MRI I guess interprets, or yeah, the software interprets the MRI, I should say. I said that backwards. And tells you how much iron is actually in the liver. So you can diagnose it that way too. Now that way is not like universally really done yet, because even though it's less invasive, it's still like not as well validated for birds. There is some information out there in pigeons and toucans about how to do it, but we don't have it validated in like all different species. Plus, MRI isn't necessarily available at every animal clinic. You know, we don't have an MRI. We have to send it off to a patient off to a neurology center to do MRIs. So it's expensive too. And it also is a little bit longer anesthesia time. The patient does have to be under anesthesia, and they are under anesthesia a little bit longer for the MRI than typically when we're doing the biopsy. But the biopsy, you're cutting the skin and cutting a piece of liver. So, you know, they have their pros and cons, but this is really the way to truly diagnose iron storage diseases. Liver biopsy, look at the tissues, or you can do an MRI. Now, there are tests in other species because this comes up a bit. Because in humans, again, this is a disease we see in humans, right? So if it's diagnosed, sometimes people will be like, well, I know, you know, when my aunt had it, you know, they went to the doctor and they had to have their iron levels checked in the blood all the time. So that's a question that comes up. Why can't we do iron levels in the blood? Why can't we diagnose it by just looking at iron in the blood of birds? That would be great if it worked that way. But unfortunately, these other tests, which are available in humans, you can run total serum iron, you can do this total iron binding capacity, or this transferrin saturation test. They don't really correlate well with the condition in birds. So they're available, but they're not really that helpful information. Now, there's a couple other tests that are available on the human side, something called hepcidin, which it's high during iron overload and it's low when there's an iron deficiency. And you can also do ferritin concentrations, but these particular tests, they're species specific, and you have to have very specific testing to run these, and that testing hasn't been developed in birds yet. So like maybe one day those tests will be available for us, and maybe one day we'll get to the point where we could diagnose this without having to do a liver biopsy and that sort of stuff, but we are just not there yet. So something that might be in the future, or we may find out that, hey, actually these don't work well for birds either. So something to be aware of, but not so helpful. Okay, so what do we do when we treat it? Let's say we have our patient who's come in and we're suspicious that something's not quite right with the liver, and then we take our biopsy, we diagnose the condition. What do we do at this point now? Well, now we have to treat it, right? So there's a couple of ways that we can treat this. And really, we usually try to do multiple things because we want to get this iron out of the body, like, and back down to normal levels, to have them be able to be healthy, you know, as quickly as we can before it starts to cause damage to other tissues. So there's two chelation agents. Chelation agents are things, it's a medication that binds up other molecules and helps it get excreted from the body. With iron, there are two specific chelating agents. One's called deferoxamine and one's called deferoprone. And both of them, they bind iron and they help the body excrete it. So it helps lower iron in the blood. One's an injection, one is an oral form. Certainly oral form sounds better, right? Like who wants to take an injection every day? The only problem is that oral form is kind of hard to get. Now, people watch these webinars from all over the world, right? So some parts of the world have the oral form easily accessed. But here where I am, in the United States, the oral form is not easily accessible. My first parrot patient, I should say, that I was able to diagnose iron storage disease when we were able to do something about it. I looked into the medication and had a hard time coming across it. I went to an AAV conference. Somebody presented on it in the Blue and Gold Macaw. And I went to talk to that person afterwards because they used the oral form of the medication. And I talked to them and they were like, oh yeah, we can get it just fine. And they gave me information on where to get it. Well, where I could get it was Singapore. So very far away from where I live. But we called to Singapore to see, could we potentially import this medication? And at the time they said, sure, we can import it. But it's going to cost over $20,000 to import one bottle of the medication. Now, that's quite expensive, but I don't know my clients that I'm working with. I don't know if they have that level of finances. So I reached out to the client and was like, hey, we can get it from Singapore, but it's going to cost a lot. Do you want this? And they were like, no, because that's a lot of money. I mean, most people can't, afford that. So we went with the injectable form instead. So it's out there. You can get the oral form. It may just be quite pricey depending upon where you live. Or depending upon where you live, again, you may have better access to it than we have here and not have it be so costly. So those are your options as far as actual medications that bind it up and help excrete it. The other thing that can be done is phlebotomies. So phlebotomies is actually taking a blood sample. And that's what this picture is here. This is a little cockatiel. She is under anesthesia when we were taking the sample. So this is just a little face mask. We don't always do anesthesia, depending upon the veterinarian. Some veterinarians like to do anesthesia when they draw blood, some don't. I generally don't, but in this picture we were. And what we're doing is we're just collecting a blood sample and you can see the blood in the syringe. But phlebotomies are a way to also remove iron from the body, right? Because what is really iron rich? Blood, right? Because we were talking about iron gets into a molecule called heme, and that's in your red blood cells, and that helps bind oxygen and move oxygen all around your body. And so if you take blood, you're actually taking a little bit of iron out as well. And so you can have a patient come in for weekly phlebotomies, and we can remove 1% to the body weight of blood, which is a safe volume that we can remove. And we can actually do that frequently to help lower iron levels better. Other things that we need to consider when we're treating this condition, we need to identify the source if we can. If, we look at the diet and find that the diet is really high in iron, then we may need to adjust that. If we look at the water and find that the water was really high in iron, then we're going to certainly want to adjust that. Unfortunately, a good amount of the time, we don't really know what the source is, but very important to investigate and see if we can find the source of where this iron is coming from. Like I mentioned, offering a low iron diet, there are, foods that are known to be higher in iron and foods that are known to be lower in iron. So we want to go with those lower iron foods. And then low vitamin C, potentially. Like I said, vitamin C is something that increases the absorption of iron. Again, the jury's still out as to how much people think it helps versus doesn't. But personally, I do usually recommend if I have a patient that has iron storage disease that they have lower vitamin C. So just to be safe. And then the other thing too that we can do is have high tannins. So tannins are actually a compound that's in some different plant sources. And one of the big things that it's in is in tea. And so you can actually have birds drink tea when they have this condition, not as their only water source, but they can have their regular water source, and then they can have like a tea that can help bind iron and help get it out of the body. In fact, there are teas that are made specifically for um, birds that are out there. Different people will market and make teas for birds. And I know of one that's called Iron Out, and it's specifically for helping to, it has tannins in it to help get iron out for birds that have iron storage disease. Okay, so we've diagnosed the problem, we've got them on treatments. Well, then the next question is, how long are we going to be treating them for? Like, what's the future look like? This is something that isn't a quick turnaround. This is not like you're on medication doing phlebotomies for 2 weeks and you're done. I wish that was the case, but that is not the case. Um, it takes a little bit of time. And by a little bit of time, I mean months to really get this condition under control. If they're coming in weekly for phlebotomies, then one thing that's done is each time we do a phlebotomy, each time we draw blood, we're going to check the red cell count on that sample just to see where we are, because we should, hopefully, with a bit of time, slowly be making them a little bit lower in their red cells because we're taking red blood cells away. Now, the body regenerates those red blood cells, so it's pulling more iron from where it's being stored in that liver, so we're getting stuff out. But you can do phlebotomies up until they become just mildly anemic. So like if their red cell count gets 1 or 2% below the normal range, that's when you go, okay, good, we're going to go ahead and stop our phlebotomies. The way to really know if you actually have resolved iron storage disease is you need to have a repeat biopsy of the liver. It's the only way to really truly know those iron levels. There was one paper out there where there was a hornbill that had iron storage disease, and they measured the serum iron. Again, it's one of those tests that doesn't correlate really well with actual iron storage disease, but they were looking at the serum iron and also were doing repeat biopsies on this bird, and they did find that the serum iron concentrations did drop. So it's something to consider as maybe like something we could follow, but it's not. It doesn't again really tell us that we've resolved iron storage disease. So it's not necessary to do it. If somebody's really interested, it could be done, but not super helpful. This is just a picture of 2 different liver biopsies. And I will say they are at different sizes, so that isn't, it's not perfect, but it's best I could do. So you can see the individual liver cells here better. So here's like a single liver cell with a nucleus inside of it, whole bunch of liver cells. This is a patient who had iron storage disease originally diagnosed on biopsy. And these granules, these were like iron granules that were accumulating in the liver. And you can see this one doesn't have that special blue stain that was on the other slide. This is just a regular stain. But you can see all these like dark areas. That's where a bunch of iron is accumulating in this bird, kind of all over in its liver. There was also some level of fibrosis and changes, scarring to the liver because of the iron storage disease. And then it had a biopsy later on, and there was a whole bunch less, just like small clusters of iron. So this bird had gone through treatment. So this was like pre-treatment, lots of iron, post-treatment, just little areas that were affected. So there was actual evidence that this bird had improvement. All right. That was my last slide. So we're done with about 10 minutes to spare for questions that people could have. At this point, I'll take any questions. This is just a picture of me again at one of those outdoor aviaries where you can go in and walk through, and the lorikeets fly and land on your head, and you can feed them. And I thought it was kind of cute because look at these 2 lories down here on my hand. Like I think they were kind of trying to both get to the food, and this one didn't really want this one around. You can see his little foot up here, like trying to push his friend away. Like, no, get away! I'm gonna eat what she has.
Oh,
So
that's funny. Yeah. I love going through those because unsuspecting visitors don't know what the spray that they're receiving is because they have liquid poop.
yeah, that's
They're
true.
like,
I
what?
didn't think about that.
All right, we do have questions, and that was once again out of the park with the PowerPoint. So question for you is it possible that iron storage disease is seen in hybrid macaws because they are generally a blue and gold crossed with something else? So,
But that's a good question. Yeah, because I didn't specifically say about the hybrid macaw, but I put that on there. So good catch. I don't know that it's necessarily because they're hybridized. I mean, that's a great question. I have to say, whenever it comes to uh, animals being bred to be quite beautiful, but not necessarily what we would see in the wild, I do wonder sometimes about the genetic things that could come along with that that might be less desirable. Um, and so far, I've only had one case of iron storage disease in a hybrid macaw. So at this point in time, I don't think that the hybridization has anything to do with the development of the disease, but I don't really know. Because again, it goes back to that thing about the genetics. Like we know in humans that there's a genetic component to it, but we really don't know that in birds because we just don't have a lot of great genetic studies yet. It's something that's one of those things that I'm sure with time we'll get more information, but right now we just don't have that information. So I don't think it's a contributing factor, but I don't really know.
okay. And then someone wanted to know, should we not give citrus to grays, to African grays? One of their grays loves oranges. So,
Again, great question. I'm going to say just in general, no, you're probably totally fine. With my one case in an African gray that I had, I will say that one of the things that they were doing before the disease was diagnosed regarding the diet was that the bird was getting uh, eggs and fish, which, an egg here and there is not the end of the world. Um, but he was getting it frequently, multiple times a week. And the fish too. And, an African gray normally isn't eating fish in the wild. They're not known for going and catching fish. I mean, sure, if some fish is dead on the shore, they might pick at it. And same thing opportunistically if they come across an egg that's um, no longer good. I mean, they might eat it, sure, but those are kind of opportunistic situations. So it's not like it's happening all the time. So I do wonder if because that bird was getting those more animal based products with frequency, if that was more the contributing factor as opposed to the citrus, because it was getting some citrus, but it wasn't like it was getting excessive amounts of it. And I mean, I have to say, with my own uh, African grays that I have, I do orange. I don't do orange every day, but they have orange as part of their diet. Um, so I wouldn't worry too much. I wouldn't worry unless you have evidence to say that, yeah, this patient has iron storage disease, or if they have hemochromatosis, which is like the precursor to it.
okay. And a question about are there cases of iron storage disease linked to older cages, like where there's powder coating or worn down or low quality powder coating? Is there an
Yeah,
association or potential?
not that I'm aware of, but it is definitely something that like should be asked of an owner. Like if I diagnose a bird with iron storage disease, not only am I asking like, hey, what's going on with the diet, I'm going to be asking them maybe to check the water too, like just see what their water source is, like because you can do iron testing easily in water. And then also like, what is your cage like? Do you have an older cage? I haven't had that be the case yet that I'm aware of as a contributing factor, nor have I heard that as a cause reported so far.
Okay, because that related question is it possible to check the cage for iron when the parrot has chewed off some of the finish? Like a little testing
Hmm.
um, mark you
You
can do
know, I wonder that I actually don't know. I don't know. They have those little like litmus paper things that you can push to things, but I didn't think about that one. So that one I don't know the answer to. I wonder if maybe some like hardware store or something would know the answer to that question.
Okay, yeah, curious. There's probably something out there, I imagine, that would, yeah,
Yeah.
be something easy to mark that. So another question is regarding tannins. So they've always been told that tannin-containing products like oak branches, especially, should not be given to parrots. Same for some teas. But if it can reduce or prevent iron storage disease, would that change things? So on,
Yeah. So oak specifically, um, I'd have to look up a little bit more because I'm not recalling anything off the top of my head right this moment. Other than oak leaves, I know have the potential to have some toxicity with some mammals, but I'm pulling that from the depths of my mind somewhere, and I'm going to have to personally go back and look that up a little bit more. So the oak I can't specifically comment on, but regarding the teas, um, a little bit of tea is fine. And black tea is really the one that has kind of more of the um tannins in it. So, the tannins aren't bad, but the tannins do prevent absorption of other nutrients, one of which is iron. A little bit of tannins is fine. Now, do you want to have them have only like tea as their only water source? Probably not. But think about a bird in the wild. Are they drinking water that is totally pure water? No, I mean, they're going to drink out of puddles, and puddles may have a little bit of plant matter in it. They're going to drink out of streams, different things where it's not totally clean water. Now I'm not suggesting people feed their birds dirty water or anything like that. Clean water is extremely important and like a basic health need. So don't, take my words to be wrongly misconstrued there. So provide fresh water, but it's okay to have some teas. And there absolutely are some teas that people have created that are safe and appropriate. So there's one that I do know is um, Polly's Boutique, I think is what it's called. I'm blanking for a second. Um, uh, Polly's Parrot Boutique or something like that. But they have teas, and then there's Jason Crean, who he has his teas as well. So there are a few good teas out there that have some. The ingredients that are put in there for parrots have like specifically been looked at to be appropriate and okay for use.
okay. On a personal note, when I spent or spent some time in the UK with relatives, I was drinking so much tea that I came back slightly anemic because
Oh, really?
people, yeah, yeah, I came because I was having like tea 3 times a day. More, anyways, yeah, a little bit anemic when I came back because they
Well,
said
so there you go. Those tannins were being really effective for you. So you overdid it.
I overdid it with the tea time. Um, so yeah, if you're drinking tons of tea and you feel a little bit lethargic, get your iron levels tested. My experience. So someone wanted to know what kind of timeline do you recheck the biopsy? Is it every month or is it less frequent?
Less frequent. I would prefer if I could do treatments for about 8 weeks and then recheck. But I would say 8 to 12 weeks, so 2 to 3 months. Do the treatments, phlebotomies, and the chelation agent, adjusting the diet, and then recheck a biopsy would be a good time because um, and at a month it's going to be too soon for you to probably see benefits.
Okay. Wow, we just did like a rapid fire question and answer. That was amazing. You got through like 7 or 8 questions and like that was awesome.
Good.
Let's see. Someone did mention that the drug. Oh wait, let's see here. Let me see if another question here. Okay, that's all. That drug, the really expensive $20,000 that's available in Mexico. Um, One of our viewers from Mexico pointed that out. So there you go. Um, I'm trying to, yeah. All right. I think my computer's frozen on my end. I hope that's not affecting people watching this. Ah, Dr. Lamb just there we go. She's okay. We lost you for a blip of a second. There we go.
Sorry.
But did you hear the part I said that one of our viewers mentioned that really expensive drug was available in Mexico? So
Oh, well, there you go.
yeah. So so there you go. Especially if you're like where I am in California, it's like a really can be a short drive to there. There we
Yeah,
go.
I was gonna say send Dr. Antonoff over the border and then see her at the next conference.
That's right. She'll do like a little, she'll take some orders and then
Yeah.
file. There you go. Um, All right. So, okay, fascinating. We had you got through so many questions. I think you broke the record for the amount of like we should just do rapid fire question answers at the end of each of our webinars. That was awesome. Okay, so next Friday we're going to be on with Dr. Tolley for another episode of Ask the Vet, and then mark your calendar and clear off 2 full hours because we're going to do our holiday giveaway on December 19th. That is also going to be an earlier start time like today. So, for example, 11 a.m. Pacific Standard Time. It's going to be like 2 hours or so. So gotta log in. We're gonna give away some fantastic stuff again. It's kind of like our annual thing now. So there we go. Uh, Dr. Lamb, thanks again for uh, taking the time to do this wonderful, informative PowerPoint. I know that there's some back work goes into that, so thank you.
Yeah,
And
you're welcome.
and I have to say that Maureen and Arroyo, man, they just nailed it. They just were the best
I know
participants.
they're well behaved today.
I know. Did you see it? They just sat, they just, well, for over an hour. That's amazing. Okay. Well, kudos to them.
Yep.
They learned. I think they were so entranced with the presentation that
Yeah.
yeah, there we go. All right, guys. On that note, I'm gonna wish everyone a wonderful weekend and I mean, all the best to you and your flock. We'll see you next time. And again, Dr. Lamb, thank you. And thank you from Michiko for working behind
You're
the scenes.
welcome.
Magic. All right, guys. All the best in your
Bye.
flock. Next time. Bye.